Hello, and welcome to this video on diabetes mellitus, a common and chronic metabolic disorder that affects millions of people worldwide. Diabetes mellitus is a group of metabolic disorders characterized by high blood sugar levels over a prolonged period. It occurs when the pancreas cannot produce enough insulin or when the body becomes resistant to the effects of insulin. To understand this, let's start by looking at what happens when we eat. Carbohydrates are broken down into glucose in the digestive system and absorbed into the bloodstream. This glucose is the primary source of energy for the body's cells. The pancreas, a gland located behind the stomach, produces insulin, which helps glucose enter the cells, where it is used for energy. Insulin also helps to regulate the amount of glucose in the bloodstream. In people with diabetes mellitus, either the pancreas does not produce enough insulin, or the body becomes resistant to the insulin that is produced. As a result, glucose cannot enter the cells and builds up in the bloodstream, leading to high blood sugar levels. There are two main types of diabetes mellitus, type 1 and type 2. Type 1 diabetes is an autoimmune disease that usually develops in childhood or adolescence, but can also occur in adults. In this type, the body's immune system attacks and destroys the cells in the pancreas that produce insulin. People with type 1 diabetes need to take insulin injections or use an insulin pump to manage their blood sugar levels. Type 2 diabetes is the most common type and usually develops in adulthood, but can also occur in children. In this type, the body becomes resistant to insulin or does not produce enough insulin to meet the body's needs. Risk factors for type 2 diabetes include being overweight or obese, having a family history of diabetes, and leading a sedentary lifestyle. Treatment for type 2 diabetes includes lifestyle changes such as exercise and diet, oral medications, and sometimes insulin therapy. Gestational diabetes is another type of diabetes that occurs during pregnancy, usually in the second or third trimester. It usually goes away after the baby is born, but women who have had gestational diabetes are at increased risk of developing type 2 diabetes later in life. Complications of diabetes mellitus can be severe and include damage to the eyes, kidneys, nerves, and blood vessels. High blood sugar levels can also lead to an increased risk of heart disease and stroke. That's why it's crucial to manage blood sugar levels and control risk factors for diabetes. Preventing diabetes mellitus involves maintaining a healthy weight, eating a healthy diet, being physically active, and avoiding tobacco and excessive alcohol consumption. Regular checkups with a healthcare provider can also help detect and manage diabetes and its complications. Thank you for watching this video.